Hi friends, in last clip we discussed what is mean by sudden death and we came to the conclusion that sudden is really ambiguous term. Now we will see why it is stressful for any doctor to declare this sudden, not only sudden but sudden and unexpected death.
Dr. C.S.Dabhadkar is consultant pediatrician at Mahad, district Raigad of Maharashtra. He is working in rural area of Konkan and known for his medical and social work in this field. He is recipient of many awards. Few of them are Jeevan Gaurav Puraskar, Raigad Bhushan Puraskar, Indian Medical Association State Award. He is also recipient of Fellow of Indian Academy of Pediatrics.
Death is integral part of our profession. We cannot avoid few of the deaths. But unfortunately, as I said in last lecture, we are not trained in dealing with this chapter. Moreover, on one side, we all the time think, we analyze all clinical material, investigations available, our discussions with our colleagues, and we try to analyze what could be cause of this sudden and unexpected death. And on other side, we have responsibility of breaking this bad news in front of all relatives. We have to take them into confidence. This requires special communication skill. We are all the time worried regarding grief and emotional outburst of the relatives, or we can say survivors. And moreover, nowadays, in this era of modern medicine, we are all the time worried regarding police cases, litigations, legal implications and everything. And because of all these things, it is really difficult for us, or it is really stressful for us to declare sudden death. Declaring sudden and unexpected death is really a problem or nightmare for any medical practitioner. And for this, we need better communication skill. Friends, communication skill is integral part of any business. In other words, I would like to say, your success or failure in any business depends on your communication skill. We are in medical profession. We all the time communicate with the patient. But communication is more important when there is sudden death. You should, by practice or by everything, you can have practice of this communication skill in few of the days. Why? On one side, as I said, we have to prepare relatives, everything, and we have to complete all formalities. Dealing with the relatives on one side and dealing with all administrative efforts like completing bill, completing death paper. If it is some medical legal case, then information to the police. If we don't know exact cause of death, then it is very likely that we have to request for postmortem, because unless until postmortem is done, we cannot give cause of death. And because of all these things, what is more important is communication with relatives, communication with survivors, communication with police, and communication, most important, is communication with your staff. Remember friends, we fail in all these things, and it's my sincere opinion that causes of all these litigations, causes of medical legal cases, causes of media interference, or I think most important reason behind all these things is improper communication. And as I said, communication is the most important thing. Where we fail in communicating patient, suppose if there is angry patient or who is not happy, then he asks lot of questions. You don't answer to him. If you don't answer or his questions remain unanswered, then it creates anxiety in the mind of patient as well as in mind of relatives. If relatives are unhappy, then it may lead to some aggravation. This aggravation again leads to anxiety. If there is anxiety in minds of patient, then anxious patients are not entertained properly. Or if their questions are still unanswered, then they may become aggravated. Once they become aggravated, then they may approach their social friends, they may approach some advocate, they may approach some legal advisor, or they may approach some newspaper reporters. If all these things happen, and if in between there is sudden death, then mob comes, then reporter comes, then media comes, and the basic cause of all this is unanswered questions of the relatives. So remember friends, If you want to avoid all these things, of course, there are so many documentation we have to do, so many consents we have to take, but most important that you should answer all questions, all queries of the relatives. This is important part of communication. So friends, in last two clips we have discussed what is sudden death and how term is ambiguous. Today we discussed why it is stressful for any medical professional to declare sudden death, and then what is the importance of communication when there is sudden death. Next time we will see how a medical profession should be trained in breaking this news of sudden death, and second, what are probable types of reactions displayed by survivors. So thank you very much. Let us meet again.
Do like, share, and subscribe.